Welcome to the Slop Farm. Enjoy the video.
You start by washing your hands thoroughly and confirming the medication, dose, and expiration. Once done, sit upright or lie back and tilt your head so you can look up comfortably. Make sure the bottle is at room temperature, and if it's a suspension, shake it well right before use. Grip the bottle between thumb and forefinger, keeping the tip sterile. You will now create a small pocket by pulling down the lower eyelid. Hold the bottle close but do not touch the eye. You pull the lower eyelid down to make a tiny pocket and hold the bottle about 1/2 to 1 centimeter from the eye. Next, gently squeeze to release a single drop into the pocket. If you miss, blink, wipe excess, and try again after a minute. Make sure to avoid touching the dropper tip to your eye or lashes to prevent contamination. Once the drop is in, close your eye softly and hold it closed to let the medicine spread evenly across the surface. After closing your eye for a minute or two, gently wipe away any excess with a clean tissue and recap the bottle without touching the tip. Make sure to wait about 5 minutes before administering another eye medication so they don't dilute each other. If you experience stinging or mild irritation, blink and the sensation usually passes, but if pain, severe redness, or vision changes occur, stop and contact your provider. For repeated failures to instill a drop, try lying.
Thanks for watching. Consider subscribing if we helped you today.